Today I want to talk about something that should outrage every single one of us. The way our elderly and infirmed are being treated inside certain nursing homes in this very state, in this very city. And I'm going to focus on one in particular because someone I care deeply about is inside that building right now struggling to survive. The facility calls itself the Blossoms at Breckenridge. Pretty little name, isn't it? But let's be honest about what it really is. That's simply a rebranded name for the old Cottage Lane Health and Rehab at 800 Brookside Drive. Same building, same ownership chain, same history, just different paint and a new name. And the official record on this facility is not just troubling, it's alarming. According to the Federal Centers for Medicare and Medicaid Services, this home is a 1-star rating, the lowest rating a nursing home can receive. Not average, not below average, the absolute bottom category. It also carries the federal abuse warning icon. That is not something Medicare puts up lightly. Facilities only receive that flag when inspectors document serious abuse or neglect that put residents in real danger. That warning has been attached to this home since early 2025. In January of this year, a federal complaint investigation inside that building resulted in an immediate jeopardy citation for abuse and neglect. Immediate jeopardy is the most severe finding inspectors can issue. It means that conditions they witnessed created, quote, a likelihood of serious injury, harm, impairment, or death, end quote. Not a technical violation, not a paperwork mistake, real danger to vulnerable human beings. Just 2 months before that, in November of 2024, the facility was fined more than $19,000 after inspectors found failures in basic operations, food safety violations, improper handling and securing of medications, inadequate nutrition planning, and failures in facility-wide assessment and oversight. Pretty much everything. Over just the past 3 years, the home has accumulated more than 40 deficiencies across nearly every category of resident care: infection control, accident prevention, dignity and rights, reporting of abuse, sanitation, medication management, and maintaining a safe and clean environment. Inspectors documented missing call systems, poor infection control, problems with resident funds, and a long pattern of failures to protect residents from harm. There are also lawsuits on record against the owners of this facility for alleged negligence and wrongful death. And multiple independent watchdogs list this home among the worst-rated nursing facilities in the Little Rock area. These are not opinions. These are not rumors. These come directly from federal inspection reports, Medicare's public database, state records, and court filings. And this is where our elderly live. This is where my friend is living. This is where people's mothers, fathers, grandparents, and disabled family members are supposed to be safe. And now someone I love dearly, a retired nurse who spent her entire life caring for others, is lying in a bed inside that same building. She's lying in her own waste. She has no call button. They gave her a little bell to ring. And she is fighting to stay alive in a facility that, by every publicly available measure, has repeatedly failed to protect the residents entrusted to its care. If that doesn't outrage you, then we have lost our way as a society. We spend billions on everything under the sun. We give billions away to other countries. Yet we somehow cannot ensure that the people who built this state, who fought for this country, who raised entire generations, receive dignity and competent care in their most vulnerable years. I'm asking families, staff, and former staff, if you have information about this facility, message me privately. Your identity will be protected. What you share may help us expose what is happening and push for better oversight, better accountability, and better outcomes for the people who can no longer advocate for themselves. Because if we cannot protect our elderly, if we cannot protect our young, if we cannot ensure that the most fragile among us are safe, then everything else we say about values, community, and compassion rings hollow. This is not political, this is moral. And it is long past time we demanded better. I'm the 501 Coroner. Y'all be kind to each other, okay?